We're here, finally. It's been a while. So this is Empathy Lab, of course, and this is our opportunity to practice with each other, connecting on our similar experiences, noticing differences, integrating them, and the group evolves. The work we're doing here is informed by a woman named Yvonne Agazarian's work with functional subgrouping. So that's what we're doing. What drives that functional subgroup, as we know, is the eye contact and the simple invitation, anybody else. Another thing, does anyone else remember another piece of protocol that we want to include?
Repeating.
Yeah, yep, summarizing the core message of the previous speaker. So, well, let's take a minute, get centered in your chair. Just pay attention to your full experience right now. Noticing how you stack in the chair. You might take inventory of all that's gone on in your busy day and gently let it go. As you've come to the hospital tonight, you may be aware that it's a busy institution. There are floors stacked above us, busy with nurses and doctors and the work of healing. And as you let that go, you might just come down a few floors to where we are, the work of this peer group. You're coming into relationship with each other during this very deliberate time. When you feel fully present and ready to connect with each other, you can sort of signal that centered place by taking up your mantle. Present. Any distractions? You all here?
I'm here. We here. honestly, I am a bit distracted. I have quite an extensive procedure on Thursday, and some things happened about a week ago, so I have to have more tests done on Thursday and have to prepare tomorrow, so if I'm a little distracted, I'm trying desperately to be here. So, but if I'm a little distracted, I don't mean to from you folks, it just...
So, Dawn, is your distraction, your specific set of circumstances, it's about the surgery coming up, is that right?
Yes. And it's not about what we did tonight or anything.
Okay.
But if I seem a little distracted or a little more quiet, I'm just kind of internalizing some of this stuff because I'm kind of nervous, so.
So the circumstances that you have surgery coming up, and can you explore maybe or share a little bit, what are the feelings around this impending surgery?
Well, I'm a worrywart, so I was born that way, and because I don't know what's going on, other than the fact that the first tests that they did showed that something's going on. So this next set, it's an unknown thing, so I am just trying to stay as calm as possible because it might be something minor that can be taken care of. So I've always been a proactive kind of person, so I am nervous, but I'm going to go through with it. I'm not going to hide and just pretend it's not there. So I'm just a little bit nervous, figure out what's going to happen and all that kind of stuff. A lot of cancer in my family. Everybody had something, so it's always in the back of my mind. So.
And as you explore the feeling of nervousness, do you feel it in any particular physical manifestation?
Yeah.
Yeah.
Well, not being able to sleep. I mean, it's just kind of hit me that the weekend's over and that it's here. So, just getting things ready because I have to have a friend take me and, that type of thing. Not sure exactly how things are going to go. And I've shared with some folks and it's because it's a good thing. But, nervousness and worry and
Do you
I got a
feel
lot
that
of-
anywhere?
excuse me?
Do you feel the nervous, like where do you feel it in your body? Do you feel it anywhere in your
Oh.
body, like right now?
Yeah.
Can you describe?
It's kind of a anxious feeling, I don't know, kind of a jiggle, a nervous, worried kind of thing.
Dawn,
Yes.
when you think about the circumstances and the feelings that come up physically and emotionally for you, and you've explored that a little with us right now, do you find yourself more distracted or less distracted right here in the moment?
Right here in the moment, I feel really safe and really calm, but because I do wear everything out here, sometimes it's seen differently than what it is, and so I thought I'd kind of explain that if I seem a little bit different than normal, because I usually try to joke around a little bit and everything, I'm kind of inward feeling right now. In fact, when we did when we went down and had the lady in the bed, and the three of you guys were
Yeah,
doing,
right.
I sat there and I went, the old feelings came back, my goals about coming into a hospital. I saw all the sheets and everything, and I talked to Leanne because, well, I talked to all of you, but to most of you, but just seeing it, and I'm like, I'm going to be there. And it was, okay, come back to what we're doing, come back to CPE, get centered, and so I've been doing a lot of extra praying.
So is the anxious and the worry, is it here right now?
Sure it is, because I'm here.
Right, so does, in exploring that and acknowledging it, do you feel more or less present in the group right now?
More present, maybe showing a little different side of me because I don't know. I thought I'd share that only because if I did show something, it's not about CPE. It's kind of my reaction to being here and trying to be present as much as I possibly can and be, sharing and that kind of thing. So.
Check with your group if anyone else feels that way.
So does anybody else see any response in a different way, or anybody feeling anxious, or?
Yeah, there you go. So I'll join you, Dawn. I'm feeling a little anxious myself right now.
Okay. And I hear what you're saying, Brian, but could you explain a little bit more about your anxious feelings?
It's kind of in the back of my knees. Just kind of a little tightness in my lower legs. Well, I'm feeling a little bit jittery. Anybody else feeling some nerves right now?
So I wasn't feeling anxious, and I feel Dawn, I'm feeling, so now I'm confused, what's mine? What's yours?
I'm sorry, did you want to summarize me?
No, yeah, no. I'll let somebody else do that.
Brian, I'm hearing that you're feeling some tightness in your legs and a little jittery anxiety, feeling almost like a a buzz, kind of, not like a high buzz, but just kind of like a vibration sound, right?
That about sums it up.
I feel a little bit of similar myself, but not from anxiety, but from discomfort being in a normal people chair. Because whenever I'm sitting in a normal person-sized chair, it's like for a normal person sitting in a kid's chair. So my legs are tight and like there's no real comfortable position to be found in the chair. So I'm feeling that a similar tightness and a discomfort. Does anybody else feel a kind of a tightness or discomfort?
A lot of looking down, just taking notice of that.
Sorry.
I wonder if there's a... Just don't lose each other, that's all.
I hear Ryan saying that because of the size of the chair, he's feeling some discomfort and he doesn't feel comfortable in the chair he's in.
Correct.
And I hear you saying that you aren't feeling the group's engagement in terms of eye contact. Is that correct?
I'm making an observation. I don't know about the engagement piece.
Okay. And I don't feel uncomfortable in my chair, but I would like to change the subgrouping of anxious, uncomfortable to I'm feeling tired. Is the group okay with the change in direction?
I'm feeling anxious.
So you would like to stay with the anxiety for a while longer?
I think that's where I am right now.
Okay.
And I can't change either, unfortunately, because I'm all involved with my
Anxiety.
nervousness, so. Can't wait to feel tired though.
I could move to tired.
It's okay, we'll stay with her.
Just-
I mean, I'm fine with that. I just have nothing to add, so just keep looking at each other.
Can I ask a question? I heard you say that you are feeling tightness behind your legs and some jitteriness or
Yeah.
in your chest.
Yeah.
And now I just heard you say that you are still feeling anxious and you asked not to move the conversation. Would you please tell the group more about what you are feeling anxious about?
I don't know if I can put words on it. It's just a felt here now thing. You know.
Well, Dawn was explaining it was circumstantial. So you're just in the moment. There's no circumstance associated with your feeling, or is there?
And I'm noticing the grinding
So my.
The squeaking too
my-
is making me feel,
Oh, this is great.
There's
So,
like a-
so this, me playing with this toy right now.
that feels anxious to me.
That me playing with the toy is making you feel anxious.
I'm just saying it,
No, I'm asking.
it represents anxiety to me.
Am I playing with the toy?
That squeak.
Oh. That's interesting. I'm just having, so are you asking me if this is anxiety in me or?
No.
Okay. Would you like me to stop playing with the toy so that you feel better?
No.
Relieves your anxiety? Because I can stop making that noise.
It just is. It is. Is anyone else feeling anxious right now?
I don't mean to shift it off, but the anxiety, I wanted to say that I felt a little anxious having that noise in my ear for that project we did. It was hard to fill out, for me anyway, because it was so loud in my ears to fill out the forms and everything. So there was a different type of, well, it was still circumstantial, but it was a different kind of anxiety with trying to find my way, how many doors it was, and to try with all of this stuff going on. Did anybody else feel that way with that
I
project?
agree with you, Dawn. Do I hear you saying that you was really aggravated by listening to all the sounds while you were trying to count and write when we was doing that special project today?
Well, Pat, I'm not sure if aggravation was the right.
What was the word you used? I'm sorry. Anxious?
Anxious. It was hard for me to concentrate. I didn't feel anger or aggravation really, but I did find it very hard to concentrate. So it gave me a little anxiety because I kept trying to focus, and it was just hard for me to do that with all of the noise.
I hear you and I agree with you because I didn't like being called a deadhead. All the different conversations that was going on in that particular exercise. I was able to concentrate. I just didn't particularly like the conversation, the language, and the sounds at the same time. I didn't feel anxious, but I was a little aggravated. Would anybody else like to join with me?
Pat, are you feeling anxious and aggravated right now?
No. I was when I listened to our project.
Okay.
Right now, I'm feeling pretty relaxed.
Oh, okay.
Pretty relieved.
So, okay. So there's an anxious subgroup, but you're not going there?
No.
Okay.
No, I was just feeling that way for the moment, for the assignment. I'm actually nice and relaxed.
Right now you're
and
feeling
relieved, relaxed, very comfortable right
Is
now.
that it?
Is there anybody else would like to join me?
Pat, I'm hearing you say that you're feeling relaxed right now.
Yes.
That's correct.
Yes.
I am not sure that I'm ready to move past the anxious. Probably would have been about 5 minutes ago. But actually now that there's been a prolonged conversation that seems to be struggling with the anxiety, that has caused me anxiety. If I'm being perfectly honest. So I am feeling anxious about the barriers in the conversation. Does anybody join with me in that?
I hear you say that you were not anxious, but now because the conversation is just seems to be staying in the anxiety, you are beginning to feel anxious.
That is correct.
And now I do not feel anxious, but I'm watching Elizabeth playing with her doll. And I would like to hear what's in Elizabeth's head regarding that doll in her hand. So I know the group has agreed not to take a shift in the conversation, but I would like to introduce again the opportunity to make a shift if the group is willing to have a shift in the direction of the anxiety.
I personally don't have a problem with shifting.
I would agree with shifting. I'd like to know what's going on with it now.
I have other feelings besides anxiety right now, so I would be open to.
So what I heard, I haven't heard Elizabeth, I haven't heard Brian, and I haven't heard Annie. Would you like there to be a shift in the group?
Oh, to be clear, I had offered a shift earlier, so I'm still a bit open to a shift in the
Okay,
conversation.
thank you.
You would like to meet anyone, would anyone else care to have a shift? I too would like to have a different opinion, different shift. I would like to go to another area.
I am also willing to shift, and it's in the hopes that I find relief from what I'm experiencing.
So I heard Ryan say that he's feeling other feelings and he'd like a shift. And I heard Brian say that he is agreeable to do the shift and is hoping that by shifting there will be some decrease in his feelings. So I would like to ask Ryan if you could share with the group what it is that has come from this conversation and the anxiety and
Yeah. I actually was a little bit connecting with what Elizabeth had said earlier with the fatigue and the tired. Specifically for me, it's not like sleep fatigue, but it's physical fatigue. Back to my chair. But like, my back is tired. My legs are tired. I am feeling physically tired from sitting as long as we have throughout the day, and it's kind of built to this point. So right now, in this moment, I am feeling like muscularly fatigued. But fatigue is the feeling, so I want to present the feeling. Does anybody else feel fatigued?
I hear you saying fatigued, physically because of the chair and just the feeling in your body. Is that correct?
That is correct.
And I feel tired, but I don't just feel tired. But I feel pretty tired right now at this moment. But I also feel, Pat mentioned feeling some. So I'm not feeling just one thing. So I feel the tired. I feel a little bit what Pat called relief. For me, I'm tired physically, but the chair is comfortable. I have something to play with, which actually gave me a little bit of joy when I picked it up or grabbed it because I was afraid that someone else was going to get it. So I'm feeling a little bit of joy playing it out. And then on the side, I sense Brian's anxiety, and even after asking if me stop playing with it would be helpful, he said no. So I accepted him at his word, and so I'm just still going with that, feeling some joy, relief, and tired, and playing with it all. So that's what I'm feeling. Anybody wanna?
Would you be able to choose sort of one of those predominant feelings?
Oh, well then that might be another shift, because if he said tired again. Maybe not joy, but just I'm tired, but I'm happy. I'm enjoying playing with it all. So I would like to center on that. That's why I keep. See, it feels complicated because I never feel just one, I often don't feel just one thing, so, but if you're asking me to choose, I'd like to do on that. Happy, or sort of, yeah, happy, contented feeling.
Ryan, do you feel joined by the happy, contented?
With the particular feeling that I expressed, no. But I am also feeling that one as well. Got lots of feelings at once. And I'm also feeling joined in the not feeling one feeling. So I feel tired, but I also feel happy and contented right now as well. So I'd say yes, I do feel joined with that.
Can we introduce another scenario? Is it possible to introduce another?
I'm not convinced we have a join yet, before we shift to yet another place.
And Leanne had brought it up, so I didn't know if Leanne was looking for something or wanted to share something particular.
No, I was just watching you play with that doll and wondering,
What it was going on.
yeah. And you explained that for me. What I heard you say was when you picked her up, she brought you joy and you're enjoying playing with her and you're feeling, did I hear you correctly?
Yeah. So, and I'm open to, so you wanted to make a join?
Just wasn't clear, was it the tired or the joy, happy joy, or the tired with you two?
So
Yes.
we joined on tired.
Okay.
I said I feel tired, and I introduced some other feelings, because I feel more feelings. You asked me to pick a feeling. I picked, if I have to pick one, I'm gonna go with the contented, playing with the doll feeling. He said he joined me on the tired and the contented. Is that correct?
That is
Ryan?
absolutely correct.
And
So-
did you invite your group? I don't know if I heard.
Anybody else? No, I did not. Thank you for picking up on that. Anybody else feel, well, since we're centering on one, the contented, I guess. Was that what
Right.
you, so that's what you joined me on, correct? Okay, anybody else?
I heard you say you're content. I'm not feeling content, but I'm happy we're off of the anxious. And I really want to talk about the toys. And I'm just wondering.
So Leanne, I'll interrupt.
Okay.
So what she asked is there anyone else who feel happy and joy or content? Yeah? If you're unable to join with that,
Then don't speak.
we
Okay.
probably need to ask the group, are we ready for a difference?
I thought that I said I was feeling content, but I would like to.
It's the but part.
Okay. So I'm feeling content and I'm joining with you and Ryan.
But
No, Ryan wasn't content.
Wait a second. Just clarifying here. You can feel more than one feeling at the same time.
So is your feeling complicated? Is that that be the feeling you're having, or your
No,
complications?
I told you my feelings. I'm just saying, how do you, so, this is like, can we step out for a second and the rules of the contrived thing that we're trying to
Right.
do? Should we stick to one emotion? Or is it, I mean, because that doesn't feel real, because our patients don't
Right.
feel just one thing. So I think,
So it's a fork in the
Leanne-
road. It's yes, we all have multiple feelings, but yeah, that's the challenge. Is what comes up a little bit stronger. If you had to choose, which
Okay.
direction would you go?
Okay. So it's not possible then to explore what she's feeling about not being able to do something with the toys right now.
If the group's ready for that, and if you can put a name on that, we could explore that.
Well, I hear you say that you're feeling contentment, and I would like to know if the group is ready to explore. And the feeling that I would like to share is curiosity. What is everybody feeling with these toys in their hands? Can anybody join me with that? Is the group ready to make the shift?
So can you say that again differently? What is your feeling right now?
Curious.
Curious, okay.
Yeah.
I hear Leanne saying she's curious.
Yeah.
So I hear you saying you're curious. I'm curious too, but I also don't want to minimize Annie raised something as well. So can we do both?
Are you curious about what Annie?
Yes, I'm curious too. I'm joining Leanne in her curiosity about the toys and also about what Annie would like to express.
What's curious like for you? What is
What's
it?
curious
Yeah.
like? It's like, ooh, want to share? I'll listen. Let's hear. I want to get to know you. Ooh, ooh.
Does it manifest a certain way physically for you?
Like and my ears are like hurt. Anybody else?
Feeling curious.
I hear you say, but anybody else feeling that curious about what's going on in Annie here? I would like to suggest another scenario. I am feeling concerned.
So you might ask your group, because you had a nice curious subgroup. We've been shifting, kind of moving, so, and it's been quick. So you might ask the group, are they ready to shift
Okay.
from curiosity
All right.
to
Okay.
concern?
Okay. I would like to know if anyone in the group is willing to shift from curiosity to concern.
I'm ready.
Okay.
You too.
Okay. Would you like to know what I'm concerned about?
Yes, we would. Do I
my
hear that you're
concern-
concerned about something?
I'm
in
still curious,
particular?
Annie.
I know. I actually would not want to know what you're concerned about.
Oh, no?
I just want you to talk to me what it's like to be concerned.
To be concerned. To be concerned is to hear something and to feel what you're hearing from someone. To sympathize what you're hearing. To feel what this person is feeling. What brings me to be more concerned with what I'm feeling and what I'm hearing.
Is it a caretaking? You want to care for someone? or-
Yes, yes, it's a caretaking, it's to feel their feeling to reach inside with them.
So ask your group if anyone else feels like they want to care for someone.
Is anyone else feeling like they want to care for someone, or concerned for someone? Is anyone else feeling this way?
Do I hear you say that you're really concerned about someone, you want to feel what they're feeling, because you really want to see what's going on with them? Is that what I heard you say?
To feel what they're feeling, to be concerned with what they're concerned with. Not so much to hear. I already have heard, but I just want to feel it, to allow them, to let them know that I feel it and that I'm concerned.
I agree with you, Annie.
Is that a joy?
That is a joy.
You also feel like caring for someone.
I always feel like caring for someone.
What's that like for you, Pat?
It's heaven for me. I love caring for people. I'm always concerned. I'm always caring. It's my nature. So it feels real good to me. Is there anybody else?
Don't lose your group.
Is there anybody else?
I'm struggling to see if you're feeling good about having concern in general, or if you're feeling concerned right now.
To Do I hear you saying you need to know if I'm feeling concerned all the time, or if I'm feeling concerned right now?
I would love for you guys to explore that right now, but time is up. So,
That's not nice. Can I tell what I'm feeling?
Yes, you can, 'cause we're done now.
Because I feel this lady. Yeah.
I had a